If you look at all the lives saved by advances in medical technology from 1990 to 2000, you would have saved 8 times more lives if you had corrected the educational disparity in health. The excess mortality, as Cindy just showed, of people who have college education versus people who do not have college education. Next slide. The environment, this is a quote from a paper put out in 2008. The typical neighborhood environment is much worse for Black and Latino children than for white children, and these disparities are not fully accounted for by differences in family poverty. So it's not just, race is not just a proxy for income. You know, who dies of gun violence? Well, a bunch of white kids in Newtown, oh, that's horrible. A bunch of white kids in Aurora, Colorado, that's horrible. But the face of gun violence, next slide, is not white. The face of gun violence is black. This is, African Americans have 15.3 times the odds of being killed by a gun, Latinos 6.4 compared to the standard white person. So gun violence is not a suburban Columbine High School, Newtown School, Aurora movie theater problem. It is a people of color environmental problem. Next slide. Related to environment is the problem of segregation, and segregation is a key determinant for racial inequalities in a number of ways, and the problems that happen in segregated communities are more than additive. You know, bad schools plus no parks does not equal 2 bad things. It equals 3 bad things and 4 bad things. It's really an exponential increase in disadvantage. Next slide. So, for example, if you're a poor person, what really matters, what's really more important to your health, to your overall health, than how poor you are, is really how poor your neighbor is. So they look at neighborhood disadvantage indexes. And so this is really interesting. Compared to the poorest 25% of white children, 76% of black children and 69% of Latino children live in neighborhoods with higher poverty rates. So even if you're a poor white person, it's unlikely that you're going to be as disadvantaged as a person of color from the same economic status, based on the neighborhood that you live in. Next slide. So racism is a societal problem. We're all affected by it, and we're all afflicted with it. You know, it's not right to say we live in a racist society. That guy over there is racist. You know, I fully believe we have to say we live in a racist society. I'm racist, and I need to figure out where my racism lies, how my racism makes itself felt, and work to fix that. There's direct physiologic effects of racism, the daily accumulated stress. That's really thought now to be the underlying issue in hypertension and the difference in the difficulty in controlling hypertension, for example, in African Americans. Unequal access to goods, services, and opportunities. And then, unfortunately, unequal medical care, and I'll end on this point. And this is not just, you know, poor people don't have access to health care. The Institute of Medicine put out a report, I'm sure most of you know, in 2002 called Unequal Treatment, which really looked at why health disparities and the racial basis of health disparities are so hard to fix. And their conclusion was that at least part of the problem is related to biases and differential treatment by healthcare providers. And that doesn't mean, yeah, I can't treat this person the same way because he or she is uninsured. It means I, one-on-one with the patient in the exam room, nobody